morning, everyone. Thank you so much for coming today. I'm César Blanco, Senator for District 29 in West Texas, and want to talk about some important items here today that's going to improve access to health care for folks. But I want to walk through some questions, and these are questions that reflect the real challenges for many Texans, doctor, but the nearest one was hours away. What would you do if you were a mother who was pregnant, expecting, scared, in need of a sonogram, but forced to drive hundreds of miles to go get the sonogram? What would you do if your child spiked with a fever in the middle of the night, but the nearest pediatrician was hours away and no clinic had any openings for days? These are the type of experience that thousands of Texans from across the state are dealing with. These are the what-ifs that they deal with every day. This is their reality. The people standing behind us today, they're not numbers on a spreadsheet. These are real people, real stories. These are our neighbors, these are our friends, these are our family members, and they're suffering. They're suffering because we've let red tape and outdated policies stand in the way of care. From West Texas to East Texas, our communities are in a crisis. And let me give you the numbers. 224 of Texas' 254 counties don't have enough primary care providers. That's 88% of Texas does not have enough providers. Over 6.1 million Texans live in healthcare deserts. Half of the state can't get the mental health care that they need. And expecting mothers, working parents, and seniors with chronic illnesses and diseases that are being left behind. So this is not just a problem, this is a crisis. It's a crisis of access in the state of Texas, that you've got to wait and that you can't afford it, and it's only getting worse. So that's why I have refiled Senate Bill 911, the Heal Texans Act. It's like dialing 911, because this bill, Senate Bill 911, it represents an emergency in the state of Texas. This bill is going to tear down the unnecessary barriers that keep Texans from getting care. It's going to allow nurse practitioners to do what they already are trained to do what they're licensed to do, and to be prepared to do it in places that have very limited access to care without the bureaucratic red tape that is in place currently. Because here's the truth. Right now, APRNs are forced to sign costly contracts with doctors who are, some of them are getting rich off the system without even seeing a patient. These are contracts that do nothing to improve access to care. So let me be clear. These contracts don't require a doctor to be in the room, okay? They don't require the doctor to have oversight at the time. They don't even require the physician to be in the same county. Think about that. Meanwhile, patients are forced to wait longer and longer, drive further and further, and pay more and more, all because outdated laws that serve no one but special interests. The Heal Texans Act says enough is enough. We already know this is an effective solution. 27 other states already do this. I served in the military, and we received a lot of our care through APRNs for primary care. The Department of Veteran Affairs also does it. And they all allow APRNs to practice without any kind of burdensome contract. And what are the results? Better patient outcomes, lower costs, and more access, especially in rural areas. And that's what's key here. If you look at a map behind us, you can see a field of blue throughout the state of Texas, and then there are light blue pockets that represent areas that are served. But the vast majority of the dark blue is underserved. So we want nurse practitioners to be able to provide high quality care in these areas. So Texas should be leading on this issue, and the reality is we're falling behind. But right now we're ranked 7th worst in the country for direct patient access. And when you look at what's happening in our neighboring states like New Mexico or Arizona, they're actively recruiting Texas APRNs to provide care in their communities because their laws are modern, their laws are patient-centered, and quite frankly, more effective. So this is not about cutting corners. We've had hearings about this in the interim and talking about what this is about. It's about saving lives. It's not about doctor versus nurse. It's about patients. This is about making sure that Texans don't have to choose between seeing a doctor or putting food on the table. This is about the elderly father who delays a checkup because the nearest doctor is too far. This is about the child with untreated ear infections because there's no doctor nearby. This is about an expecting mom having to drive hours to deliver her child, only to find that there's no doctor on site. So the Heal Texans Act is for them. It's for the families. It's for the future of Texas. So I want to thank my colleagues, especially our Health and Human Services Committee Chair, Vice Chair Charles Perry, Senator Bob Hall, Senator Angela Paxton, Senator Mays Middleton for recognizing the urgency of this issue and supporting this bill as joint authors. Look, the lack of access to quality care and affordable health care is a crisis in our state, and the Heal Texans Act is the solution. Let's do what's right. Let's pass Senate Bill 911 because Texas can't wait any longer. Now, I'd like to welcome my dear friend, SB 911 joint author and Heal Texas Act and Human Services Committee Vice Chair, Senator Perry, to say a few remarks. Thank you, Mr. Vice Chair. Appreciate it.
Well, he's an attorney and I'm not, so he speaks a whole lot more eloquently than I do. CPA by trade, so I'm not known for speaking. Bottom line, when I came into the legislature in 2011, this was a conversation we were having back then. Scope issues, whose territory are you treading on? Here's the deal, we've treaded on patient access territory for far too long. Technologies have changed. An APRN today has access to tools to support their endeavors in primary care development that were not there 2011. They've got a support system that's available by virtue of technology alone that changes their world. I will tell you it is a rural healthcare issue. I will tell you that convenient access to healthcare is a determining factor of whether people will actually go get healthcare. I hate to say it, but if it's 200 miles away, you may go in and that may be the visit that started a treatment plan that saved your life forever. So we've got to break down those barriers, not an inflection or a reflection community at all. This is another symptom of a fast growth state. We're growing 1,500 people a day. We cannot graduate enough doctors specifically desiring to be in primary health care to meet the needs of Texans. It's not a reflection of those guys at all. They do great jobs, but at the end of the day, nobody to deliver access to care, nobody to visit with when you have those earaches or those symptoms that you can't explain is no health care at all. So this bill changes that direction. We're going to continue to fund GME slots to graduate as many primary care doctors as we can. We can't force them to go into primary care, but at the same time, we're going to expand a market of already well-provided providers, well-schooled providers, people delivering this health care already. In a large part, every place in Texas where you're urban or rural, I'd venture to say your first encounter now into an MD's office that you couldn't get in for 9 months is their APRN. And that just reflects that this industry has evolved and matured to a level where we can have confidence that the care they deliver and the support system that exists and their willingness to continue to have that support staff interaction down the road. But it cannot be the support staff aspect of it under the guide of someone that they don't even know who they are. They're just a number on a contract. That's not real support. So I'm proud to co-author this. This is your second round. You know, sometimes it takes a couple of sessions to get things done. We're working through the minutia of some of the nuances of it, and we're going to get there. I feel pretty good. Vice chair of that committee, but I know the chairman has indicated it's time for a broader scope indication of where we can be in Texas for healthcare delivery. Texas is just too big, too diverse, and too spread out to maintain a viable healthcare access system without this initiative. And I think we're going to be in good shape. But thank you again for filing it. Thank you guys for being here. Is this my APR? I know this is an APR and I love it, but I saw the bosses. There's one, and yeah, there was another. Tessa was the baby, I think. There was a couple of babies, but that's what it's about. Don't want to interrupt that. I get hangry too, so I mean, we got to do that. We're not graduating any Marcus Welbys anymore. We're not making the house calls anymore. The new doctors, to their credit, want a balance of family and life that wasn't there. This fills the need, and it's ready to go. So I think we're on a good path. Appreciate you guys covering it.
Thank you, sir. Appreciate it. Yes, sir. Thank you. Thank you. Thank you, Vice Chair Perry. He and I represent West Texas communities, very rural communities, so we have these conversations all the time about the lack of access to care. So thank you, Vice Chair Perry. With that, let me please welcome Ms. Susie Clary. Thank you. Appreciate it.
Thank you.
You bet. Thank you.
I'll give you that.
Okay, thank you.
Get my notes out here. There's so much. I don't want to miss anything. First of all, I want to tell you I'm Susie Clary. I am a breast cancer survivor. Thanks to my nurse practitioner. I just celebrated my 5th year this summer from being cancer-free, so to speak. So, and like I said, I have my nurse practitioner to thank for that, and I know y'all are kind of through now. But she walked with me through my journey, and I actually am blessed. I have 2 nurse practitioners. One behind me here, Melanie, thank you. She was very strategic. And Anna East, we miss you today. Wish you were here too. But Anna East and Melanie walked beside me in my journey. I didn't have a doctor standing there holding my hand. I had a nurse practitioner. And I live in a rural community. I'm from a flying and farming and ranching community of Sudan, Texas, but I currently live in the West Texas town of Post. And yes, it is P-O-S-T, Post. We have more cows than we do people, more pump jacks than people. But all of that to say, it's an hour in any direction to the next community. Not to the next big town, but the next small community. And so we don't have doctors there. You want to go see a doctor, it's a minimum of an hour one way. And I don't have to do that because I have nurse practitioners that I go to first, and I can call them and I can get in that day. A doctor's office, you call, well, we can't see you today, maybe 2 weeks from today. Well, by then I'm either really, really sick or, you know, who knows. So I am grateful for that. All of our little rural communities are spread out. It's not just, you know, hit and miss. We have a few big towns in West Texas, but we have a lot of small communities and a lot that do not have nurse practitioners. They don't have doctors, they don't have anything. And I know that may not seem like a big deal here where you can, a doc on the box on the corner. Well, we don't have that. And a few years ago, my nurse practitioner, it was, you know, that time of the year where you go for all your annual stuff, and I kept putting it off. And my nurse practitioner called me and kept calling me. She didn't hand it off to a nurse. She didn't hand it off to the lady at the front desk. My nurse practitioner called me and stayed on me until I came in for my appointment. And thank goodness she did. Because I will tell you, if it hadn't have been for my nurse practitioner staying on me until I made that appointment for my mammogram, I would not be here. And I don't say that lightly. God, that's the truth. I would not be here. I had my mammogram done, and they called me and said, oh, you know, we kind of messed things up. And I thought, probably not. Said, but we need to see you again. I said, okay. And I went on Friday, and they did biopsies. 7:30 Monday morning, my phone rang, and it was my nurse practitioner. And here in Lubbock, but they can't, the first opening is in 3 months. 3 months. And if you don't know, stage 4B, that's bad. And so I said, well, it's okay. I know an oncologist personally. I can call him and get in. I said, but I'm going to need some help here because I have an elderly mom and I need to be here for her, but I need to do this. She said, okay, I will do whatever I can do to help you. Well, she knew I don't take no for an answer. I will just tell you that now. I'm not always politically correct. I am down to earth. Let's get it done. And I called her back and I said, okay, that was Monday. Wednesday, I had an appointment in McKinney with an oncologist. She said, how did you do that? I said, I called him and said, I need help. And so my nurse practitioner says, what do you need from me? And my oncologist gladly called her and said, I'm glad you have her. So, long story short, I did not fight my breast cancer alone. It took a village. It took both of my nurse practitioners so that I could get the shots that you have to have the day after chemotherapy, the x-rays that I needed to do. I could do those all locally, and not everybody will get Neupogen because not every patient they see that day is going to need Neupogen like I did. But they did that. Not a doctor in a doctor's office, but the nurse practitioners were there for me. I could call them on a moment's notice. I'm running temperature. I'm not feeling good. Get here. You call a doctor's office, you don't get that. And it's not that they're trying to be rude. They've got 50 patients in their waiting rooms. Not that nurse practitioners don't have those patients. But they can say, hey, I've got XYZ. You know, I can walk in their office and they all say, hey, Miss Clary, how are you? Because they know. Even the lab techs there know who I am because of my nurse practitioners. You know who I am because of my nurse practitioner. A lot of fees. Those fees need to be lessened. They need to go away. We're losing good nurse practitioners, y'all, and we can't afford to. Texas needs to step up. We need to step up. Y'all need to step up. We got to do better. You know, Texas is bigger and better. We got to be better. This bill needs to pass. And thank you for doing this and leading the way for us to have better health care. Because, y'all, we're the best, you know? Texas is the best. We need to be the best. Step up. Love y'all. Thank you.
Thank you so much. Appreciate it. Well, thank you so much, Susie, for sharing your powerful story. And you're right, Texas needs to be the best, and we need to lead the way. So thank you very much. I'd like to now introduce Dr. Philip Day, who is an Army veteran and a retired military physician. Dr. Day?
Thank you. Good morning. I want to tell my story. My name's Dr. Philip Day. I'm a physician. I practice medicine in the Killeen, Fort Cavazos, used to be Fort Hood. They reflagged it recently. For a lot of years, and I was in the United States Army as a physician. They put me through medical school for a little over 20 years. I'm here to stand with Senator Blanco, patients, the over 40 organizations who support Senate Bill 911 for one simple reason. Texans need better access to medical care. As a physician and fifth generation Texan, my father's family got here in 1851 and never left. They're still over in East Texas. I wholeheartely support this legislation that would remove unnecessary barriers to APRNs like nurse practitioners. It's the right thing to do. It's long overdue. In my years in the military and the Army, my family and I, we received good quality care from a lot of different healthcare practitioners. Some were nurse practitioners, some were physicians, and we saw no difference. I mean, I raised my son and daughter, and they're alive and well, and everything's they're normal. And everything was fine. I noticed no difference in the quality of care. Sometimes even I, as a physician, would care. And you can't tell in the Army because they don't. I'd have to ask if what is your training? I just was curious. So I couldn't tell the difference between some physicians' assistants and nurse practitioners and colleagues that were DOs or MDs. So firsthand I witnessed the critical role nurse practitioners played in delivering care to active duty Army soldiers, their dependents, their children, elderly parents, reservists, National Guard people, retirees, of which I am now one. I won't go there. In the military and the VA, a long time ago, the Department of Defense recognized that nurse practitioners were valuable and gave them full practice, decades ago, a long time ago. So my career was just part of that. The Veterans Administration did that, same thing in 2016. I find it curious that in Texas, we have some of the largest military installations and the largest veteran populations in the country. And yet we don't allow nurse practitioners the authority that they have earned by education, their training, and their experience. My eyes were first when she became an APRN, got her master's. Still today, by law, they're required to have a delegated or a delegating physician for chart review and monthly visits. While this process may sound reasonable to some, in my daughter's experience, it was kind of a hollow requirement. The mandated chart reviews and meetings occurred usually long after, weeks, sometimes months after the care had been delivered. And it really didn't do anything for the patient. It met a bureaucratic checkmark requirement, but it didn't do anything for that patient's care. There are paperwork burden that the doctors don't like, the nurse practitioners don't like, but it's the law, and you don't want to disobey the law. It takes time away from their patients. It takes time away from their practice. So I've testified here in the legislature in 2017, and I'm really disappointed. It's 7 years later, and nothing has changed. I was hopeful it would change, but there's been a lot that's gone on since 2017. The COVID-19 pandemic, a nationwide shortage of healthcare providers, all of them, thousands of them are from California. I go to church with some of them. The population increase, the maternal and mental health crisis, riddling rural and urban areas alike. SB 911 signals urgency, and time is of the essence. I can tell you that Texas lost the pretty extensive education of my daughter Claire and her experience as a nurse. She was in the ER in San Antonio for 10 years on the graveyard shift. And her husband, my son-in-law Brent, he's a PhD counselor, they relocated to Oxford, Mississippi and take care of people at the University of Mississippi and all of the indigent people in rural Mississippi. They're doing well. They've given more autonomy. It's rewarding work. They serve underserved and not just underserved populations. They're valued and appreciated as a member of the healthcare community. And the reality is there's no formal delegation or piece of paper is needed for this collaboration. It doesn't have to exist. That's what it means to practice as a member of a quality healthcare team. So my daughter she grew up in Texas. We raised her. She wanted to stay in Texas. She tried practicing. She had some bad experiences, the restrictedness and the cost to her delegated physician. So when they had a chance, they relocated to Mississippi, and we lost her. Texas patients lost her, and now she has to come a long way to see me and my wife. So she's over in Mississippi, happy as a clam, doing very well, very fulfilled. So SB 911 will without a doubt improve access and care for patients. It will help keep these dedicated, highly trained professionals relocating to other states. My daughter Claire seriously thought about going to New Mexico. She had a couple offers, but she didn't like the desert and she wanted to go to Mississippi. There was competition for her services. The Department of Defense recognized the valuable contributions decades ago. The VA did that, like I said, in 2016. I don't know why Texas would not do it now. As a physician, veteran, patient, and father, I urge Texas lawmakers that they need to take a stand and support SB 911. The HEAL Texas Act, it's time to finally end the legacy, I'd say questionable legacy, of power, profits, and control and put patients first. Thank you.
Thank you, Dr. Day. Appreciate your military service and your service as a physician to our community and your family's continued service. We wish they could serve here in Texas where we really need it as well. So now please welcome to the podium Ms. Tina Tran, State Director of AARP Texas.
Good morning. I'm Tina Tran, State Director for AARP Texas, and on behalf of AARP Texas and our 2.5 million members across the state, we are here to support Senate Bill 911, the HEAL Texans Act, and to thank Senator Blanco for his leadership on this important legislation. I'd also like to thank Senators Hall, Middleton, Perry, and Paxton for their support. In Texas, there are 3.9 million people age 65 and older. And by 2050, that number will grow to 8.3 million, dramatically increasing the demand for all health services. Texans need access to quality health care, and that need is acute for the growing number of older Texans and family members who care for them. An aging and growing population puts a strain on our healthcare system, and supply of primary care providers is not keeping pace. Access to health care is a problem for older Texans across the state and is particularly prevalent in our rural communities. The HEAL Texans Act will allow APRNs to provide the care they are trained to offer. The solution is safe and sensible. It will help ensure Texans can get the primary care they need in the communities where they live. As with the case with the Veterans Administration and more than half of the states across this country, Texans should benefit of better access to care by allowing APRNs in Texas to practice to the full extent of their training. AARP Texas is a strong supporter of Senate Bill 911, and we thank Senator Blanco for his leadership on this important bill.
Thank you, Director Tran. Really appreciate it. With that, we'll go ahead and open it up for questions. Yes, ma'am.
Hi, my name is Sue Wilson, and I'm with the Texas Silver-Haired Legislature. And I was wondering, there may be a spillover effect of Senate Bill 911 to both services for aging Texans, because they won't have to drive. Because nobody, I'm over 65, but the issue of driving to medical care isn't, that is an access issue. And if I can get care closer, it becomes even better.
Right.
So, there's a spillover effect. It's even better.
Absolutely.
You get a double whammy.
Right. And that's the idea. We want for patients to have access at home, in their home communities. I represent communities that there isn't a physician within 250 miles one way for a patient. So can you imagine driving, an elderly person driving 250 miles one way? If they have a 9 o'clock appointment with their physician, you've got to wake up extremely early, drive a long way, see the physician, and then, right. Right.
Right.
Not at all, right. So this is the idea, and I'm glad you brought up that question, because we're bringing access to care to the patient rather than the patient going and driving long distances for care. So thank you very much. You bet. Yes.
Steven, since the Texas Tribune, I was going to ask, I know during the pandemic, a lot of discussion was had about sort of our nursing workforce and how many of them had left and to other states or just retired altogether. Is this sort of an answer to sort of building up that workforce, or are you hoping to attract people back?
Well, we've looked at some of the data, and the answer to the question is yes. If we release the barriers that APRNs have to provide primary care, keep in mind, we're talking about only primary care. We're not talking about surgeries. We're not talking about specialties. These are primary care, advanced practice nurses. And if we open it up and release the bureaucratic red tape, we're going to see an influx of APRNs coming to the state of Texas. That happened in the state of Arizona. Once they released those delegated authorities, they had a lot of people going in. And where are they going? Mostly to rural areas to provide care. So that's the idea. We have a nursing shortage. We have a doctor shortage. APRNs are already trained and licensed to do this work. We want them to do it without the ability of having bureaucratic red tape to slow them down.
Can I say something?
Yes, sir.
They temporarily did suspend delegated authority in COVID-19 just for urban areas for community systems. So APRNs are kind of let loose. Not everybody wants to admit that. But when it happened, they did very well, and nobody was afraid of it. So it's been done, but it was like a process. So it's already been tried.
Right.
It's just been for a while.
Right. Thank you, doctor. Appreciate it. Any other questions? Yes. Well, one of the major roadblocks is the lobbyists that have been hired by physicians. It's a very powerful lobby. There are a lot of myths out there that we're watering down care, but there's no data that demonstrates that any of the care is watered down. In fact, there are studies that demonstrate that quality of care is increased. There's a lot of money behind it, and it's a challenge. But we've got people, and we've got patients, and I think that's where the power lies. So we're going to take this information, we're going to educate our legislators. As Senator Perry said, sometimes bills have their roadblocks. It takes a few sessions to do it. We're taking another go at it, and we definitely have more momentum this time, and we've got a lot more awareness, and the data is there to demonstrate that patient outcomes are better when APRNs are providing primary care. Any other questions? Thank you all so much for coming. We appreciate it. And thank you to the families that drove all the way out here to be part of this. Thank you so much. Thank you so much. So nice to meet you. We appreciate it.
Well,
Powerful story.
anything I can
Thank you very much.
We appreciate
We'll,
it.
we'll definitely ask you to come and testify when we start hearing you. Thank you for all you do. We appreciate it.
Appreciate you sticking with us.
Yep, absolutely. We got to do it.
Yeah,
We got to
yeah.
do it. You bet.
So
Thank you, sir. We won't stop until we get that patient out.
I didn't mean to get back behind them.